I love to talk to patients about their options and how to improve the appearance and contour of their tummy. And basically they sort of split into two separate groups. One is liposuction and another is some form of tummy tuck, or the doctor lingo as we call it, an abdominoplasty. And really the discriminator or the difference between the two is how much extra skin there is and how much expectation we can have that if you do suction alone that the extra skin that you have will shrink back. With liposuction, through small incisions, and there are different technologies that we might use depending on your skin and other things that we'll discuss after we do an examination. But we can remove the fat either with typical suction, or sometimes we use ultrasound assisted suction. But the technology is there. We can get the fat out through small incisions. The big discriminator on how good your result will be is how your skin is going to lay down and be smooth or not after liposuction. And that's when we do your exam, we'll talk about what our options are. When we start to talk about an abdominoplasty, and sometimes there's a group of patients in the middle that can get a good result either with liposuction, with some particular expectations, or with an abdominoplasty if those expectations are different. And the big difference with an abdominoplasty is we have the ability to actually physically remove skin, so we don't have to rely so much on your skin's natural elasticity to shrink back. Sometimes, no matter how many sit-ups or crunches or how strong your muscles are, if that layer of tissue on top of the muscles is loose, then that can be a big, powerful thing that making an incision and giving your surgeon an option to tighten that tissue, which we call fascia. When we bring that together and tighten it, it really tightens the foundation or the basement of your abdomen and can many times get you a much flatter, better result than you could get with liposuction alone.